Pediatric psychiatry patient, 9-year-old boy. Parents brought him in with a bunch of different symptoms, and we'll go through this real quickly. Self-report, a number of errors, just the parents report mildly outside normal limits. When we get to the objective data, we're looking at a pretty slow response speed, higher variability, inattention measured by higher commission errors. So he's having some trouble with focus and attention. Interesting was resting heart rate for 9-year-olds 100, and his heart rate variability is pretty low. That's low for anybody, and it's also a V-shaped pattern, which is consistent with chronic fatigue. And when we saw this, I asked the provider, and she said, yeah, he's having trouble sleeping, quite restless. That's not a surprise based on that finding. And then when we look at the event-related potentials, we got pretty fast sensory visual processing. And what's interesting when you have very fast sensory processing visually, sometimes that's compensatory. If you may have some auditory processing deficits and the visuals picking up the slack. Some delayed cognitive processing, the P3Bs, pretty fast awareness and attention on the P3A, but the power's kind of low. So from a latency standpoint, it's okay, but the power's low. So there is some indication that we probably have some inattention, but some hypervigilance. And in fact, that is what the physician reported, that he's very edgy, has trouble settling, and we'll get his raw EEG here in a second, but having trouble settling and having disruptive sleep. As a result, he's also having some headaches, and some of that, by the looks of the muscle artifact, temporally, T7, T8, we're seeing a lot of muscle activity, which is mastoid, also seeing frontalis muscle tension, P8 also parietal, probably some coming off the neck. So we have several muscle artifacts that could be contributing to the headaches. When he closes his eyes, some of that goes away, but he still does have some mastoid tension you can see there. And then from a quantitative EEG standpoint, his peak alpha is a little low. Generally, for a 9-year-old, we're looking at 9, 10 hertz by now being your dominant peak frequency. This is a little low, and that's correlated with cognitive impairment. So cognitive impairment is low alpha. So his low ideal 9.5, 10.5 alpha rhythm is low. And when you see that kind of thing, one thing that comes to mind that can improve that is, believe it or not, an amino acid found in a green tea plant called L-theanine. And it's generally safe in children up to a pretty good high dose. So that's a consideration. He's on no medication at this point. What we're looking at here in the eyes closed on the right, we're seeing an elevation of frontal beta 1, and a lot of it's right hemisphere. And that's unique. And for one particular reason, we see more autistic symptoms with right beta. It's probably some coherence difficulties here as well. This is an amplitude measure, absolute power, and waiting on MTHFR labs yet. But I have a suspicion that it's going to be positive, MTHFR positive. So a couple of findings, there is temporal slowing, not the typical anterior cingulate frontal central like with ADD, but this is more of language processing. Frontal is Broca's area, Wernicke's area, language processing situation. So there's some difficulty there, and that would explain why he's also having some trouble with school. And this is an indication for speech pathology evaluation, and that would be one thing. And also to try something like L-theanine first before maybe even some prescription options to try to reduce this beta and increase this alpha. That's something L-theanine does quite well, unlike something like GABA, which will cause an increase in 3, 4, 5 hertz, which we don't want. We already has way too much of that as it is. So that's a quick, rapid overview with a couple from the hip, pretty safe interventions to start with, but getting some improved sleep, increasing alpha, which will help him settle and focus better. We may get some gains just with that, and we could repeat and also take a look at what the labs say. Hopefully that quick review was helpful. And also the sourcing of this is important too. You can see the generators for the language processing issue here again, temporal, and we see this again temporally. We're seeing this slowing, the 5 hertz elevation of 5 hertz has a generator in auditory processing. So I think we're looking at some kind of auditory processing, possibly some autistic spectrum symptoms as well. And this region here, Broman area 40, where he has elevated beta, this is a pretty classic area for recognizing facial grimaces and determining emotion from that. We see that in the ASD cases as well. And there's some indication that he does have some trouble there too.